So Hodgkin lymphoma is a highly curable malignancy, so we are able to cure most of our patients with first-line therapy, but we have around 5 to 10% of the patients that are primary refractory and around 30% of them relapsing after achieving a first complete remission. So in these patients, autologous stem cell transplant is still the standard of care. We have been able to improve the results of autologous transplantation with the introduction of PET-adapted strategies. So those patients who are PET negative before transplantation, we know that they do better than those patients who are PET positive. And in patients who are PET positive, we try to implement other strategies. And we have been able to introduce what we call new drugs, basically brentuximab vedotin and checkpoint inhibitors, to improve the disease status of the patient before the transplant in order to improve the results of transplantation itself, and to eventually use consolidation strategies with brentuximab vedotin after transplantation in those patients that have high relapse risk. For those patients who relapse after the autologous transplant, we have been using allogeneic transplantation for many years. Nowadays, probably the numbers of allotransplants have decreased or are going to decrease a little bit because we have very good results with new drugs that have lower toxicity profile and are, let's say, easier to be used. And these new drugs are eventually competing with the patients that could undergo the allogeneic stem cell transplant.